COVID has changed all our lives, and as my colleague Kevin Stewart pointed out earlier, it has shone a light on the challenges of those who depend on social care and health services as never before. Impacts on carers, those in isolation, on shielding lists, those with disabilities, and those who are lonely in our communities. But it has also shown the civic spirit in which our communities rose to the challenges of COVID. And we must learn the lessons of this. It's not about getting back to normal, it's about getting back to better. Building a better solutions in our communities, a patient-centred service that has well-being of those working and fair work at its heart. In 2009, I was a counsellor, and one of the things that deeply disturbed me at that time was that a Scottish Council commissioned services by a reverse auction. A race to the bottom on cost, not about the quality of service, not about an existing quality workforce, and not about the well-being of those who would have to deliver those services. But fair work at the heart of this will mean that the well-being of those workers will be better, they'll be paid at least the living wage, and it's crucial that in delivering the services, it's going to build a care service that delivers dignity and respect to our neighbours, their families and friends, and those in our communities who depend on these vital services. It will be no surprise to those that have been here for a while that for a number of years I have championed the cause of pancreatic cancer. And part of the work that I've done over the years has been asked, the community there have asked for a sea change in the way we tackle, the way we look at pancreatic cancer. It's an unforgiving illness like no other. It is one of the poorest survival rates of any cancer. Late diagnosis frequently being something that happens, and with what are days and weeks for pancreatic cancer can be months and years for survivors and other cancers. One of the things they asked for was that they have a pathway to diagnosis that met the needs of those who were coming into contact with this terrible disease. And the Cancer Recovery Plan announced in December is investing £114.5 million to tackle and help those with pancreatic cancer. And the early patient support that will be given and the one-stop shop of diagnosis and treatment will change the lives immeasurably for people who are coming into contact with this. And not only that, the SHPBN networks in Scotland now have a patient support network. This was all championed by Jane Freeman and has all been happening while COVID has been going on. And it's a testament to the immense pressure that our health service people have been under, that they've been able to make such progress in this area alone. This is what we have to be moving forward with. An independent review of social care gives us a clear roadmap for recommendations for a future care provision in Scotland that we can all rightly be proud of, we can all rightly take part in, we can all rightly ensure meets the needs of our friends, our neighbours and our communities going forward, and that we build dignity for those in receipt of the services, but also for those who are working in our services. Thank you, Presiding Officer.
Thank you.